So getting back into the focus of today's show, raise your hand if you ever woken up more tired when you went to bed, or if someone has told you you snore like a truck and you just laughed it off. What if I told you that tiredness, that snoring, that morning headache could be your body literally fighting to breathe at night? Today we are talking about sleep apnea, a condition that affects 1 in 4 adults, but most people have never heard the name. Joining us on the Pulse Show is Mrs. Stephanie Sampson, founder and managing director and head clinical neurophysiologist at Beta Neurodiagnostics here in Pietermaritzburg. With over a decade of experience, Stephanie specializes in EEG sleep studies and the diagnosis of brain nerve and sleep-related conditions. She's passionate about making complex neurological topics easy to understand and helping patients get timely, accurate diagnosis. Welcome, Stephanie. It's great to have you here at the Pietermaritzburg studio.
Hi, thank you. Thank you for having me. It's awesome to be on your show, and it's exciting to speak about sleep apnea today.
Let's get the show on the road. So, Stephanie, can you tell us, in simple terms, what exactly is sleep apnea and what's happening in the body when someone stops breathing at night?
So sleep apnea is a condition when your breathing repeatedly stops or becomes very shallow when you're asleep. Each time this happens, your oxygen levels drop. Your brain briefly wakes you up to restart your breathing, and this cycle can happen many times a night without you even knowing it.
So what's the difference between obstructive, central, and mixed sleep apnea?
Well, you've mentioned 3 types of sleep apnea. Obstructive sleep apnea is the most common, where the airway becomes blocked or collapses. Central sleep apnea happens when the brain temporarily doesn't send the signal to breathe. And mixed sleep apnea is a combination of both.
So tell me, Stephanie, do most people even know they have sleep apnea?
You know what? It actually often goes undiagnosed because the symptoms happen while you're asleep. So if your partner hasn't told you, or somebody that sleeps near you hasn't told you, then you probably wouldn't have known.
And what are the classic warning signs someone should listen for?
Well, number 1 is loud snoring, choking, or gasping during sleep, waking up with a dry mouth, morning headaches, excessive daytime sleepiness, poor concentration, irritability, and somebody telling you you're not breathing enough at night.
So can children or young adults get sleep apnea, or is it just for older, overweight adults?
Absolutely. While it's more common in older adults and people who are overweight, children, teenagers, and even young adults can also develop sleep apnea.
Why is it snoring? Why is snoring not just annoying, but when it's obviously dangerous? Can you actually just maybe elaborate and tell us the dangers of snoring?
Okay, so not everyone who snores has sleep apnea. But loud snoring combined with pauses in breathing, choking, or excessive daytime tiredness should never be ignored. It can be an alarm that your body gives to you, that it may be a warning sign of a serious condition. So when it's tied in with somebody that snores and not breathing adequately, then you should be alarmed.
And Stephanie, what happens to the brain, the heart, and blood pressure during repeated apneas all night?
So every time your breathing stops, your oxygen levels fall. The brain has to wake up the body just enough to breathe again. This repeated stress increases blood pressure, strains the heart, and prevents deep restorative sleep.
And what happens when your patient doesn't get treated, probably for 5 or 10 years? What's the dangers?
So over several years, untreated sleep apnea significantly increases the risk of high blood pressure, heart disease, stroke, diabetes, memory problems, depression, and even early death.
So Stephanie, you're telling us that obviously these are high risk, could be on an increase for our patients.
Yes.
And is daytime fatigue and brain fog always from poor sleep, or could apnea be the cause?
Definitely. Many people think that they're simply tired or stressed when they're actually being woken up tens to hundreds of times per night without even realizing it.
Does sleep apnea affect memory, concentration, and mood?
Yes, poor quality sleep affects concentration, decision making, memory, anxiety, irritability, and even increases the risk of depression.
So, do you also see patients that might be overweight that's diagnosed with sleep apnea? What is the link? Can you actually inform our listeners?
It's actually a two-way relationship. Excess weight increases the risk of sleep apnea, but untreated sleep apnea also changes hormones that control hunger and metabolism, making weight loss much harder.
And are there dangers in specific jobs, like, for example, people that might be working on machinery or driving? Are there actually risks with those type of work positions?
This is actually a major concern. Untreated sleep apnea increases the risk of motor vehicle accidents because many people fall asleep or have delayed reaction times, even if they don't realize how sleepy they are.
So can you tell me, Stephanie, in your profession, obviously you diagnose sleep apnea. Can you take us through a scenario? Is a hospital sleep study still the only option? And you can tell us a little bit about what that is about.
So I think what you're asking is how it's diagnosed. And usually we use a tool called a sleep study. A sleep study is gold standard, where the patient will be connected to a machine whilst they sleep to monitor different variables to help us identify if the patient is positive for the condition. You will have a machine. It's not a big cumbersome machine. It's quite easy to sleep with just a belt around your waist, a probe on your finger, and a few other attachments that will look at if you are positive for the condition, how severe it is, and obviously what type of sleep apnea it is. The second part of your question, I would say ideally at home would be recommended to have the sleep study done because you're sleeping in a familiar, comfortable environment. You're following your normal bedtime routine, which often gives us more accurate reflection of how you sleep on a typical night.
And Stephanie, if someone thinks they have sleep apnea, what's the first step they should take?
Well, first step, speak to your doctor or a qualified sleep practitioner. If your symptoms suggest sleep apnea, then they'll probably refer you for a sleep study.
So we sometimes hear, if you have sleep apnea, you got to be put onto a CPAP machine. What treatment options exist besides the CPAP machine?
So treatment depends on severity and cause. Options include weight loss, positional therapy, oral appliances, treating nasal blockage, surgery in selected patients, and lifestyle changes.
So when we talk lifestyle changes, can losing weight or changing sleep positions actually cure mild apnea?
I mean, it would be great to say there's a cure for sleep apnea, but unfortunately there isn't. For some people with mild sleep apnea, maybe they would improve their symptoms by losing weight, sleeping on their side, and it could resolve mild cases, but it should always be confirmed with the test, with the sleep study.
Yeah. Stephanie, we actually see on socials that there's mouth guards, oral appliances. Do they really work, and who are they for?
That's a tricky one. This varies with patients, and it often works best in conjunction with the CPAP machine.
So we're going to talk a little bit about the CPAP machine a bit later, listeners. So hold on to the show, and we're going to actually unpack about the benefits of the CPAP machine with my guest after a lunch break later on. What role does nasal congestion, allergies, or enlarged tonsils play in treatment?
So these can worsen airway obstruction. Treating allergies, nasal congestion, or enlarged tonsils can improve symptoms and sometimes reduce the severity of sleep apnea.
I know, Stephanie, we are chatting later that you work with a diverse and a mix of multidisciplinary teams from ENT surgeons and neurologists and goes on. So is surgery an option, and do you work with the team to make recommendations, and when is it considered?
So surgery, yes, definitely an option, but only for carefully selected patients. Surgery may help if there's a specific anatomical blockage that's causing the problem.
So, listeners, if you've just joined the Radio Al Ansar team here in Pietermaritzburg, we're on the Pulse Show with myself, Shabnum, Ismail, and we have Mrs. Stephanie Sampson, the founder and managing director and the head clinical. She is in the neuro field, and she is helping us to understand sleep apnea better and what can we do to prevent a life-threatening occurrence. So we're going to actually take a quick break. Don't go anywhere. Grab that cuppa and stay plugged right here on Al Ansar. Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners. You are listening to Radio Al Ansar, 90.4 MPT Marisburg, 105.6 FM. I'm Shabnum Ismail on the Pulse Show, capturing the heartbeat of our community. So every night while we sleep, over 900 million people around the world stop breathing, sometimes 30 times an hour, sometimes up to a minute. They don't know what's happening. Their partner knows, their body knows. That condition is called sleep apnea, and it's linked to heart disease, stroke, diabetes, and even car accidents. The good news, it's treatable, and that's why we're here today. Welcome to the show, Stephanie. It's great to have you and Farishna with us, and we're going to cross over to Farishna, who's in our Durban studio, listeners. So it's a very exciting day that we're unpacking about sleep apnea. So Farishna, can you tell our listeners, can exercise and diet improve sleep apnea even without any other treatment?
Good morning, Shabnam, Stephanie, and to all the listeners. The gold standard for treating sleep apnea is a CPAP machine. Although weight loss does help, but the best solution and to helping solve the problem is a CPAP machine.
And this question is posed at Stephanie. Are there any medications that can help or make apnea worse?
So there isn't a medication that cures obstructive sleep apnea. However, sleeping tablets and certain sedatives can make sleep apnea worse because they relax the airway muscles.
So being in the field for so long, Stephanie, can you tell our listeners what's one myth about sleep apnea you wish that the listeners would stop believing?
The biggest myth, I would say, is that snoring is normal and harmless. It isn't always. Snoring can be the body's warning sign that your breathing is being repeatedly interrupted.
So Stephanie, let's go back to devices. How can our listeners know if they fall into the category of sleep apnea?
So there are screening tools. We use validated screening tools to help assess the risk. One is the Epworth Sleepiness Scale, which measures how likely someone is to fall asleep in everyday situations, giving us an idea of how sleepy they are during the day. The other is the Stop Bang questionnaire, which looks at major risk factors such as snoring, tiredness, observed apneas, high blood pressure, BMI, age, neck circumference, and gender. These questions do not diagnose sleep apnea, but help us identify people who are at high risk and should have a sleep study done.
So let's talk about the CPAP and how it's going to help you listeners to save your life. And we have Farishna Inderlall, who is a seasonal healthcare professional with over 3 decades of experience in the medical field, having begun her career in 1994. So throughout her journey, she has held a variety of roles, building a strong foundation of knowledge and expertise across multiple facets of healthcare. For the past 17 years, Farishna has specialized as a medical rep, focusing on primarily the oxygen concentrators and the CPAP machine. And her dedication to patient care and respiratory health has positioned her as a trusted and reliable resource within the industry. So Farishna, can you tell our listeners about the CPAP machine? If they're listening about it for the first time, what does this machine really do?
Thank you. So a CPAP machine, so basically CPAP stands for continuous positive airway pressure. So what a CPAP generally does is it actually pushes in air into the airway passages, preventing an obstructive apnea. There are three types of machines. A CPAP, which is a constant pressure machine, and then you get an APAP, which automatically adjusts the amount of pressure it delivers based on the breathing of a patient. And then you get a BiPAP. This is used under unusual circumstances where the patients have other comorbidity issues. So a BiPAP allows the patient to absorb the air during inhalation and exhalation. So it's a very it's like using a little ventilator, but it's a non-invasive one. So it's a very specialized machine.
Obviously, with the aesthetics of the look and the feel, you've got a patient wearing a mask over their face when they're going to bed. Have you had reservations from many of your patients?
There are two types of masks. So a full face mask that covers the nose and the mouth, allowing one to breathe as one would normally through the nose and the mouth. Then there is a nasal mask, and this one covers the nose only. This mask is smaller, allowing more freedom of movement without creating a leak. Many patients find it difficult to become used to breathing through the nose only, so they would use then a full face mask. It looks more daunting than it actually is, and once the patients get a good fit on that mask, it becomes so easy and they sleep so much that the actual look doesn't affect it. And generally a mask is only put on when the patient is going to bed, the lights are off, and they know they're having the best sleep. So it just takes a little bit of getting used to, but once they've got the hang of it, it's the most comfortable and best sleep they're going to have.
If you are listening on this topic of sleep apnea, we are now talking about the CPAP machine and the benefits. So Farishna, tell us, is the machine noisy? Is it like a generator next to you? Will their partners be able to sleep?
The modern devices are whisper quiet. Your bed partner wouldn't hear you breathing. It's very quiet. The only time they may hear you is if you've got a leakage on your mask, which can be adjusted, but it is absolutely quiet. I have a colleague who shared his experience on how quiet the machine was. His wife touches his forehead at night just to see if he's still breathing because they can't hear it. It's so quiet.
What does it feel like for the first night with a new user? Is there any adjustments during the early stages?
Some patients find it really easy. They adjust on the first night. Some patients may take a day or two. But if you've got a good fit, your mask is used correctly, it doesn't take more than a week for a patient to become compliant using the machine.
So today we're walking you through what is sleep apnea, the risks, and how we can help you get your energy and your nights back. And I've got two experts in the studio, one based here in Pietermaritzburg, the other at our Durban studio, alhamdulillah. We've got Farishna and we've got Stephanie. And right back at Farishna, can you tell our listeners about the device in terms of the cleaning, how often the CPAP mask or the tubes and the filters need to be cleaned? And do you guys give this tutorial to your patients?
Hi, yes. Okay, so your mask is the one thing that you're going to put on your face every single day. So that needs to be cleaned daily. When I speak to the patients, I tell them as soon as you wake up, please rinse your mask. That you have to keep clean every day. A proper clean should be done on your mask every week. Your tube and your filters have to be cleaned at least once a month.
Having a baby and taking care of the device. Basically, having something that's added onto your portfolio, it's something that you obviously have to take care of on a regular basis.
Sorry, I didn't get your question.
Yeah, I'll repeat. Obviously, it's something that the person has to repeatedly take care of as part of their well-being.
Yes, definitely. Your machine and your mask is your life-saving equipment. It's your new bed partner, and you have to take care of it. It's a very expensive piece of equipment, and you want to make it last. And if you keep it clean and you protect it, it will last you a good few years.
Expensive. Can you tell our listeners, is it covered by medical aid? What is the cost of the device?
Most medical aids cover the devices. The funding often comes from the appliance benefit or your savings. But at Ecomed, we have a CPAP from in different price ranges. So I'm sure we can accommodate a lot of patients. We also offer the PayFlex option, which patients can purchase via PayFlex, and it makes a huge difference to their affordabilities.
And Farishna, can my listeners carry the CPAP when they are traveling for the Umrah or abroad? What about power cuts or camping?
Yes, the CPAP machine can be transported. We do have devices that have backup batteries, but an inverter can be used with your machines. Devices are very transportable. For frequent travelers, small devices are designed for them to actually purchase. They are a bit on the pricey side, but if your patients can afford inverters, they work very well with your machines.
Normally see with some new users that actually makes them quit using the machine?
Because OSA is a condition that only occurs in deep sleep, patients are not aware of the seriousness of the disease. In light sleep, patients might feel that the treatment is keeping them awake a little bit, but this feels as if one is losing sleep and becomes a reason to quit. But patients who persevere and use the machines properly and the mask fits, they get such a good sleep and they feel so good the next day and in days to come that they would not go to bed without it.
So how long would it take for somebody to see the benefits or see more energy and less headaches?
Not all patients respond the same. Many patients feel the difference the very next day. Some of them take about 2 or 3 days. Some of them possibly a week. But generally, after about 2 weeks, they should start feeling a huge difference.
And for someone scared of being hooked to a machine for life, what would you say to encourage those listeners out there and the public?
OSA is a serious condition, and that can only be treated with CPAP therapy and not be healed. Technology has improved the sound and the comfort levels so much that it's so much easier to use the CPAP machine. And CPAP treatment is the gold standard. Other options for treating sleep apnea are seldom more effective. So once your patients get used to the therapy, they don't even feel the machine or the mask. Once you get used to it, it's just a little bit of perseverance. And I always tell them, if you can do 4 nights with that machine today, try 5 the next day, try 6, and eventually you won't be able to sleep without it.
Farishna, how can the patient get in touch with you or your company? Do they have to go through their physician or their doctor and obviously get referred to you for the device?
Generally, the reports are sent to us by the sleep laboratory. There are some doctors as well who would send us a sleep report. And then we will contact the patient and we apply for the CPAP machine and we do the deliveries, we do the compliances, we make sure our patients are properly fit, they are compliant with the machines, and our patients are monitored. We do a compliance on the patient to make sure they're actually using the machine and they are feeling the difference.
Any final words from your side, Farishna, before we move over to Stephanie?
Yes. A few tips. Wear it every night. Nail the mask fit. The one thing that makes or breaks comfort. Expect a short adjustment and push through at least for a week diligently. If your nose or throat feels dry, ask for a humidifier. Ask about a humidifier if your machine doesn't have one. Keep your mask and your machine clean. It's quick and it matters. And if something's uncomfortable, call your provider or adjust it rather than quitting. You don't have to tough it out on your own. Speak to us.
There's always a solution, listeners, to sort any medical problem. We're going to move over to Stephanie. Stephanie, thank you for being with us today and for sharing your expertise. Is there any final words for our listeners and how can they get in touch with you?
Thank you so much for having me today. I hope we've shown that sleep apnea is far more than just snoring. It's a common, treatable medical condition that can have a significant impact on your health and quality of life. If something we've discussed today sounds familiar, don't ignore it. Reach out to your healthcare provider, ask questions, and get assessed. Better sleep truly has the power to change lives. Sleep well, stay healthy, and thank you for listening.
Thank you to you ladies for helping save a life. I hope our listeners has found this topic inspiring, so let's bring it home. Sleep apnea isn't just about snoring. It's about your heart, your brain, your energy, and your life. The good news, it's treatable from what you've heard. If you recognize yourself or someone you love in any of the signs we spoke about today, loud snoring, waking up tired, daytime sleeplessness, please don't ignore it. There is a solution. Get treated. Go and check in with your doctor. Talk to your doctor, get screened, and get help, because everyone deserves to wake up rested and to live a healthier, fuller life. We've come to the end of the show. I'd like to actually thank you listeners for plugging into The Pulse. I'd like to thank the technicians for connecting us today 3 ways between the listener in Durban, myself, and also Stephanie. Follow us again next week, Saturday. We've got another amazing show lined up. It's the only one you've got when it comes to your life. So take care of yourself. Until next time, take care. Assalamu alaikum wa rahmatullahi wa barakatuhu.